Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. We're here today with Mike Graham, the American Dental Association's Senior Vice President of Government and Public Affairs, representing over 163,000 ADA dentist members. Mike Graham has fought on Capitol Hill for issues important to organized dentistry for over 25 years, serving in various positions in the American Dental Association's Washington office. In total, he has nearly 40 years of government affairs experience in the federal and state legislative arenas. He has represented two other associations, has served as a gubernatorial appointee for two Maryland governors, has worked for a U.S. Senator from Maryland, a Maryland congressman, and a Maryland state representative. Mike has a master's degree in public policy from the University of Maryland, Baltimore County, and a BA from the Catholic University of America. Mike retired as a commander in the United States Navy following his service in Iraq. Mike, thank you so much for being with us today.
My pleasure. Thank you for inviting me.
Well, Mike, we want to get right into the issues here. There are so much information out there that has come out, a lot of great information and work from the American Dental Association. There's also a lot of confusion, and I'm really hopeful and grateful that you're here today to clarify some of the things for our members. So, the CARES Act is now law. There's over $2 trillion package. How will this help dentists who are facing practice closures or significant limitations on operations? Please tell us some specifics about this.
Absolutely. Well, we have a tremendous amount of information that we have put up on ada.org. And I know so many of your members are also our members. Let me just quick sidebar that there's been a lot of misinformation. And the reason why is because people are looking at different versions of what I might call the final document or the final document. And the problem is a lot of firms, even some high-profile magazines, were not looking at the final version of the CARES Act when they started reporting on it. And so I can tell you that the ADA has gone to great lengths to make sure that everything that we have put up has been verified more than 2 or 3 times so that we know that our information is accurate. So let me start off with some of the provisions that I think, in probably the order that they need to know them in terms of importance to the dentists themselves, to their practice, and even their employees. And let me start off first with there's 2 loans in particular that are of importance to the dentist owner. And the first is what's called the EIDL loan, or the SBA 7B loan. And the EIDL stands for, and it's EIDL, the Economic Injury Disaster Loan. And this is the purpose of this loan, is to provide some quick money to that small business that may not have a lot in reserves, and they have to pay for things like rent or mortgage, utilities, and even insurance. So we highly recommend that dentist owners, practice owners, go up on the small business website, and we have all this information up on ada.org, and apply for the EIDL loan. It has been streamlined. It was the application process took about 2 hours before Sunday. They streamlined the process so that it would take about 20 minutes. They will give you a number. For those of you who may have applied for the EIDL loan, the SBA 7B loan, about a week ago, they may not have given you a number, so you may need to reapply. And in fact, we just posted how to do that up on ada.org. So first and foremost, get an EIDL loan. If the first $10,000 of that loan is actually a grant, so you do not have to pay it back. So let me give you an example. If you took out a $50,000 EIDL loan, the first $10,000 would be a grant. So your loan amount would really be $40,000. And you can use that for qualified expenses. So it's rent, it's utilities, it can even be used for payroll. But while you've applied for that, you may want to consider, and I would talk to your accountant at every step, but you may want to consider applying for, as soon as they become available, an SBA 7A loan. Now, that's also known as a PPP loan, a Paycheck Protection Plan loan. Now, why would you do that? If you apply for the 7A loan after you apply for the EIDL loan, when you get the money for the 7A loan, you can use that money to pay for your employees' salaries as well as benefits. And if you keep good records, and you have to keep good records, if you keep the good records, you're allowed to use that money for up to 2 months. Then they give loan forgiveness for the amount that you've used within that 2-month period, if it's used for those purposes that are specified. Again, payroll and benefits. And so you don't have to use all the EIDL money, the 7B money. You only use that if you need to, let's say, but you can actually get loan forgiveness for the 7A money. And that's first and foremost. The other things that I think every dentist should know is that the CARES Act also allows for deferment of student loan payments for up to 6 months. That means you don't need to make a payment until after September 30th on all Department of Education held loans. If you refinance the loan with a finance company, you should call them and see what they can do for you. As we understand it, all of them are interested in helping out those that have student loans, but you need to call them and find out exactly what they'll do for you. Now, those are the two big things that I think practice owners in particular would care about. But any dentist, of course, who has a student debt would probably care about the second one.
Right.
But there's also two provisions in there that I think are important for your employees, because I know dentists look at their employees very much like they look at their own family. And if you made the decision that you might have to furlough your employee, you should know that the CARES Act provides an additional $600, up to $600 per week, on top of what the state unemployment benefit is. So that's terrific. It bolsters that pay. So if you have had to make the decision to furlough your employees, and by the way, there is a difference between furloughing your employees and laying them off, and your accountant, your attorney can tell you. In some states, furloughing the employee means that you can still pay for their benefits, so you don't have to get into the whole COBRA thing. And so there's that bump in unemployment insurance. The second thing is that many of your employees may be eligible for this, what they refer to as a rebate, where if they paid taxes in 2018, and if they even filed their taxes already in 2019, they may be eligible for up to $1,200 for the single filer who makes less than $75,000. And for the joint filer, it would be $2,400 if they make up to $150,000. So those are some really key provisions.
Yeah. Well, let me thank you. That was really valuable, and I want to just kind of cover a couple of specifics there. Most importantly, you said that the details around this are on the ada.org site, and one can go there and get specific instructions, as you just laid out, in terms of the order of doing things and the process for applying. Is that correct?
Yes. In fact, we just put up a fact sheet yesterday that explains the two loan programs very well. And the ADA worked in concert with the Academy of Dental CPAs. There's actually a group of CPAs that work exclusively or almost exclusively with dental practices. And so we spent all weekend long, well into the night sometimes, and long conference calls developing this 2-page fact sheet that tells you everything you need to know, I think, about the 7B loan, the EIDL loan, as well as the 7A loan. And we even have, if you go on it electronically, I mean, you can there. If you go on the website, you'll download the fact sheet, and you can actually click right on the site where you can get in and apply for the disaster loan. So we try to make it very easy for everybody.
So obviously, it's recommended that people do this as soon as they're able because you want to make sure you're in online and it's going to happen. But is there another reason in that there might be only a limited pool of funds and they could run out?
Absolutely. So thank you for bringing that up. So Congress said we will set aside $10 billion. Now, in most cases, $10 billion with a B is a big, big number. But if you do the math, you'll find that if 1 million small businesses all applied for the EIDL loan, you would use the money up. $10,000 times a million, and you get to 10 billion. So,
right.
So yes, we are pushing this. That's another reason why you want to do it first. When people say, "Oh, why do I want to do that first?" Well, because there's only so much money. That's why. And if you need that quick infusion of cash, there's $10,000 you can use to keep your business going
right away. And what happens if the SBA loan money runs out? Then what? You kind of alluded to it, but then what?
Well, if they run out of the grant money from the EIDL loan, then really what you need to do is you can still apply for an EIDL loan. You simply won't get the grant money, that $10,000, if you will, that you don't have to pay back. But then you may want to move on and just apply for the 7A money.
I see, the PPP.
Correct.
Money afterwards. But you have to apply for the 7B before the 7A, is that correct?
You actually don't, but I can't see a reason why. And it's a good question, actually, because people will say, well, why do I want to apply for the 7B money, meaning the EIDL loan money?
Right.
It's because you can use that for a number of different purposes, and the terms are very reasonable for the EIDL loan money. It's 3.75% over 30 years. The terms for the 7A money are 4%, not much more, but they're 4%, but it has to be paid back in 10 years. So if you need to spread it out, you can only spread it out to 10 years under the 7A loan program. So we're saying apply for the EIDL. You can use that for those other purposes. The 7A money, it's true you can use it to pay mortgage. However, problem is you can't get loan forgiveness if you're paying the mortgage on it. You can only get the loan forgiveness if you're paying for your employee's payroll as well as the benefits. So that's why we're saying go for the EIDL first. Makes sense, yeah.
And in your conversations and what you're hearing, Mike, do you believe that Congress is considering other future legislation that may help dentists as well?
You know, they absolutely are, and depending upon who you talk to, I know Nancy Pelosi is saying that they're actually beginning the process on the fourth package. Senate Majority Leader Mitch McConnell actually came out with a statement today and said, you know what, we want to see how this third package is working before we create the fourth package. And yes, there are people always working to see, okay, where do we think we want to spend it? But Congress is out until April 20th anyway. So I know there are people behind the scenes that are thinking about the fourth package, but I think when they come back, they'll be thinking more in earnest what they would like to see in that package.
I wanted to ask you about your personal observations of what you're seeing from legislators regarding, the position of dentistry. We're helping out in so many ways right now, in part by providing important PPE to the frontline healthcare providers. We're working together with them. We're treating patients on an emergency basis as we eventually reemerge after COVID-19. What is your perception of how dentistry is being heard by the legislature on both sides?
Well, there's two good stories there, actually. I do think it's important for dental practices to remain open. And I believe the last I heard is that about 75% of dental practices are remaining open. And here's the reason why it's important. It's important, and of course, I want to caution this by saying that I hope all dentists and their staff are adhering to the most stringent safety standards that they possibly can. But it's important that they remain in there to treat the people who need emergency care. And the reason is this: if they don't have the dentist to go to, then they're going to go to the emergency room. And unfortunately, the problem is in the emergency room, as we all know, that the hospitals are jam-packed treating the COVID-19 cases. So I think dentists are doing a great job, a great civic duty by seeing those emergency cases in their offices. To the extent that they can, they should practice the precautions that the ADA has laid out, and I'm sure AAPD has on your website.
We're aligned on that.
Yep. Absolutely. Mm-hmm. The second thing is also a very good story, and that is that as of Friday, and I'm sorry I don't have any updated numbers on this, but the vice president came out, I believe it was last Wednesday, and said, and he expressly mentioned dental practices and said, if you have extra PPE that you can donate, please donate it to the hospitals. And I got to tell you, it was very heartwarming to learn of large projects in 22 states. And this was a Friday. And that are out there.
It's overwhelming.
It is. So it's again, dentists doing the right thing, and that's terrific.
Yeah, regarding the first thing you said, Mike, I think it's well known to all of us and to local health jurisdictions that prior to all this, in most states, dentistry was either the number one or number two reason for visits to emergency departments.
Right.
So, and that problem's not going to go away after this. So we definitely have to sustain it now and figure out better ways in the future to avoid those emergency room visits that could be treated by dentists in their office. And, and prevention. I mean, prevention is going to prevail even more because with proper home care and professional guidance, we can prevent a lot of those things anyway. And we're fortunate to be in a profession where prevention works. So I wanted to ask you a couple other quick things before we finish in our short time today. I've heard that the ADA, the APD, and other dental organizations petitioned the Department of Labor for relief from certain paid leave provisions in the previous law passed by Congress. What's new with that effort?
Well, actually, we've got some very good signs that they're going to come out. We believe they've already started giving some information in this area where they have set some criteria whereby small businesses, 50 or fewer employees, would be able to say if let me take a step back. If just to kind of refresh everybody's memory here, that when they passed the second coronavirus package, there was sick leave and extended family leave provisions in there that said that an employer would have to pay 2 weeks of sick leave or paid time off for an employee who was in one of 6 circumstances, whether they lived in an area where it was a mandated quarantine, if the employee had had the virus, if the employee was ordered by the physician to be quarantined because they had the symptoms, or if the employee was taking care of a family member. So those are the big 4. And so, but there's 2 more. And the last one I won't get into, but the 5th one's important. But the first 4 are really probably rare cases. And, there are a number of cases, a couple 100,000 maybe now in the country, right, of cases. But if you spread that over 330 million people and you ask yourself, how many of your employees have it or taking care of someone with it, it ends up not being many.
Right.
The number 5 circumstance was that the employer would have to pay for 2 weeks of paid time off if the employee had a child who was home from school because the school closed down. Now, there's 30 to 40 million kids that are home from school. So we're now talking about some real numbers.
That's everybody, pretty much. Yeah.
Yep, that's a whole lot of people. So,
yeah.
So in that case, a small business, 50 or fewer employees, could petition for an exemption under that fifth circumstance. The kid is home because the school is closed. And the same thing is true with extended family leave, which would be an additional 10 months on top of 10 weeks, 10 weeks on top of the 2 weeks of sick leave or paid time off, if the kid was home from school because the school closed. And and so in our letter with our sister organizations, AAPD, ADA, and so many others, the letter said we would like all dental offices to be exempt from the provision both in the 2 weeks of sick leave and the extended family leave provision where the employee was home because the child's school was closed. And the reason is that for many small dental practices, paying for essentially 12 weeks of salary for each employee in that situation could break that dental practice. And you know what? If the dental practice wants to pay for that, we wanted the dental practice to have the option. If the dental practice
make that
wanted to
decision,
pay for that,
yeah.
they could.
Mm-hmm.
That's right.
Yeah.
So some information has come out of DOL, Department of Labor. We actually expect there's tomorrow morning at 11 a.m., there is going to be a press conference on this, and we believe that they're going to we have not come out with a statement because we're waiting for this. We were waiting for this statement from the Department of Labor that said we hope definitively what the ruling is. But it looks like they, and I don't want to give any false hope, but it looks like they're headed in the direction where if a dental practice, for example, with 50 or fewer employees, was going to meet some grave financial trouble, because they had to, and they could document that. If you had 10 people on your staff who all had kids home from school, I mean, that would be a problem. And as long as you could document that, you would not have to you could be exempt from that. So
yeah,
I think that's what we're looking at. We'll see. Yeah.
Well, that's excellent. This is all great information, Mike. And I want to thank you on behalf of all of us for all the work you're doing on behalf of dentistry. It's really important. You've clarified things for us today, and we're all going to keep following and staying connected and till we get through this together. So thank you so much for taking your time. Yes, you want to add something?
Can I add one last thing?
Absolutely.
And this is how, we always say dentistry, one voice united. And, the medical community is nowhere united to the extent that we are. And when we reached out and sent emails to Capitol Hill on two different occasions, as you recall, with regard to this third package, the first time we asked our dentists to engage, and that's all of our dental organizations, the first time we asked our dentists to send emails to Capitol Hill, we had about 75,000 dentists sending over 200,000 emails to Capitol Hill.
Wow.
And that is unbelievable. But when we went back the second time and asked our dentists, send your emails to the Hill and ask Congress to keep these provisions, these important provisions in the bill, provisions that are important to our dental practices and our employees and really our patients when it comes down to it, we had over 375,000 emails going to Capitol Hill from, I believe it was over 120,000 dentists. So, and to put that into perspective, one very large association in Washington that touts themselves as being one of the best grassroots organizations in Washington, and I won't say their name, but they turned out an impressive 284, but we turned out almost 100,000 more emails. than they did. And so
pretty impressive. Yeah, it shows that you're right. It tells how aligned we are, how we're together.
Yes.
And I think we've been together in the past, we're together now, and we'll be together in the future as we emerge from this.
And we need to be. And we need to be to be successful. Yep.
Yeah. Well, Mike, thank you so much for taking your time. We'll stay connected with you and get the information from ada.org to get information, the latest specifics for the entire dental community on response to COVID-19 and what we can do to help ourselves. Thank you.
Thank you so much.
And thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.